I'm going to be explaining the menstrual cycle in hopefully a more understandable way. So to start, the main couple of things to know are that this menstrual cycle is a reoccurring cycle, and on average, it's 28 days long. Ovulation is going to occur around day 14 of the cycle, and it can lead to one of two things. It's either going to lead to a pregnancy occurring or menses. Now, hormones are going to be what's in charge of this whole cycle. So the hormones are FSH, or follicle stimulating hormone, LH, or luteinizing hormone, estrogen, and progesterone. So let's start talking about these hormones and their different jobs. So we have a pituitary gland, and that pituitary gland is going to release either, or not either, both of them, FSH and LH. All right, so our pituitary gland releases FSH and LH. These are going to stimulate follicles in the ovaries. So over here, our ovaries, we have follicles. It's going to stimulate these follicles to mature. So what does that mean? It means they're going to grow. They're going to get bigger. So we have our follicle growing bigger. Each follicle is going to contain one ovum or egg inside of it. As the follicles grow, they are going to secrete estrogen. Okay, so LH, our hormone LH, is going to start to rise, and estrogen is going to peak. So our estrogen peaks and LH rises, and that is going to cause ovulation to occur. And do you remember what day of the cycle that is? Yes, that occurs on day 14 of the cycle, or around day 14. So that egg is released. It's going to be released from the follicle, and it is going to travel down the fallopian tube. So it travels down the fallopian tube, and it is looking for sperm to hopefully be fertilized. Fertilization will occur in the fallopian tube if it's going to happen. So you ask, what now? Well, now FSH and LH are going to decrease. And do you remember that follicle over here that ruptured and released the egg? That is going to become the corpus luteum. And that corpus luteum is going to secrete progesterone. So our last hormone. And progesterone is going to help maintain a pregnancy if a pregnancy has occurred. Let's look at it separated into different phases to break it down even further. So we have the follicular phase, ovulatory phase, and luteal phase. So first, and this is the follicular phase, FSH and LH are going to increase. They're on their way up. And this is going to stimulate those follicles to mature. So remember, we have our ovaries, and there's follicles in there. The FSH and the LH are going to cause these to start to grow and mature. And then that one dominant follicle that we have is going to produce estrogen. And then we start to see LH also increasing. Then in our ovulatory phase, the LH is going to surge. The egg is going to be released from the follicle. So that follicle that has the egg, it's going to be released and travel down the fallopian tube to be fertilized. And then that follicle is secreting the estrogen, and it is going to thicken that uterine lining. It's going to tell that uterus to get ready for implantation if fertilization has occurred. So our last phase, ovulation has occurred, which remember happens around day 14, and we're now in the luteal phase. So FSH and LH are going to decrease. And you remember that ruptured follicle that contained the egg. You know, that follicle had the egg, it ruptured. It now we have it turn into the corpus luteum. Okay, so that corpus luteum, and it is secreting progesterone. So progesterone and estrogen are going to cause the uterine tissue to thicken for implantation. And that's what I mean when I say it's going to get ready. So progesterone and estrogen are going to cause to thicken, and we're going to have an increased blood vascularity to help with implantation. If implantation occurs, it means we have a pregnancy. Without it, without implantation, without fertilization happening, then there's no pregnancy. So all the hormones are going to decrease, and that's our FSH, LH, estrogen, and progesterone. So they all decrease if there's no pregnancy, and that means we have menses. So the uterus is going to shed that lining. So what are women going to feel during this? Typically, they're going to feel nothing until menses occurs. So if menses starts, they're going to have cramps, usually some, possibly some skin breakouts or some acne occurring, breast tenderness, and mood swings. So the reason why we have the mood disorders, mood swings happening is because we have a rise in hormones, and then remember, they come crashing down. So it's going to cause those fluctuations in the mood swings. The cramps come because we have the uterus is a muscle, so it's going to be contracting and causing cramps to occur. It's contracting because that muscle's trying to get rid of the unused product. So we didn't have conception, we didn't have implantation, so now that endometrium lining is being released. Breast tenderness and acne are happening because of the hormones. So this is a normal process. There's really no treatment. However, we can let women know they can take some NSAIDs like Motrin to help with the pain and ease the discomfort. Diet can also be modified. So that would be complex carbs. So things like brown rice, just no high sugar items. And then the last thing we can help suggest is exercise. So things like yoga, just to help with positive endorphins and to help with relieve the discomfort can be beneficial. For nursing concepts, the patient's pregnant, or if she gets pregnant, we're going to consider reproduction to be a concept. And then comfort is another concept because it's likely that pain will occur for this patient during menses. Let's look and review these key points to remember. So remember, it is a 28-day cycle, and ovulation is occurring around day 14 of this cycle. It is dictated by hormones, and our hormones are FSH, LH, estrogen, and progesterone. And then there's two possible results. We either have a pregnancy occur or menses occur. Make sure to check out the resources attached to this lesson. Now go out and be your best today, and as always, happy nursing.